what I'm going to touch on today is some of the costs of lockdown themselves that we've seen over the last 18 months or so, and relative to their benefit are limited, if any. And then towards the end, I'll talk about some of the things we could possibly have done differently and definitely need to be doing differently next time. So I first want to just cover this. This should be fairly straightforward to everyone here, but I think we need to acknowledge that every public policy actually has a cost. In most cases, they are explicit costs, and in some cases, there would be opportunity costs of one policy versus the other. However, what we observed throughout this pandemic is that most governments around the world just simply pretended that lockdowns had no cost. And because they pretended there were no costs, there was no real attempt made to quantify or communicate these potential costs. Now, clearly, there are a lot of downsides to that approach, which we can recognize. One of them, obviously, is that if you don't acknowledge that there will be some costs to a particular policy, you can't really do much about them proactively. I'm quoting Professor Paul Dolan here, who actually inspired some of the points at the end of the presentation too. But basically what he says is ultimately any policy will affect one or both of two main welfare concerns for individuals, namely life expectancy and life experience. So I'm going to cover a little bit of the South African context here, which is actually where we inspired our first paper in May last year. What we were running into when we were talking to people about the lockdown and that there would be a cost is that the flippant response we often ran into is that it's just the economy. It's just the economy. It doesn't matter. We can pick the economy up again. This is totally worth it. And that clearly didn't make a lot of sense to some of us. So what we understood inherently was that the economy ultimately sustains life. So what we tried to do is to say, actually, let's try and use a metric that people might be able to understand. So assuming that lockdowns may save some lives, we can quantify that. What is the cost of the lockdown in terms of lives themselves? So we specifically looked at the life expectancy angle to this equation. And my background in doing actuarial pricing for life insurance, which is super exciting work generally, helped me understand what are the kind of trigger points or what are the kind of metrics that we use to price life insurance, because we're taking long-term bets with real money in pricing and trying to outprice our competitors around how long people are going to live, essentially. And there are some obvious ones that will make sense to you. We know there's a gender difference in life expectancy, and age is a good predictor, and smoking status. But in South Africa, and I think most of the developing world, there are two really, really profound predictors of life expectancy. One being your income, your household income as an individual, and the second being your level of education. Now, the education one is important because even after adjusting for income, an individual's level of education is highly correlated with life expectancy. So I'm going to show you very quickly what that looks like in a South African context. So this graph at the bottom is household income. Now, that's in rands. So if you want sterling, you can divide by about 20. And on the vertical axis, you've got relative mortality. So one being your baseline mortality. And as you can see, as your household income falls towards zero, your relative mortality increases by 3 times the baseline, so by 200%. I want you to also observe in this graph that at 30 or 40 or 50 or 60,000 Rand of household income per month, there's very little change in your relative mortality, predicted relative mortality, but it gets very, very steep at the lower ends of the income graph. And people have mentioned earlier today that very few people have had skin in the game. And when you are a well-paid academic or policymaker or government official who is A, losing no income, and B, at the high end of the income curve, the cost of the lockdown from your perspective on this metric is essentially nil. When we modeled the South African response to the first hard lockdown, and we are still in a lockdown today, we basically predicted how many people are likely to be falling into poverty, especially going from that threshold of about 10,000 Rand a month towards zero. And what is the impact of that going to be on mortality? And we were very generous, and we assumed there would be a positive life saving from lockdown in South Africa, which we don't necessarily believe anymore. But even under that scenario, the cost of lockdown on this simple metric alone, ignoring everything else, and we know there are other costs, was about 30 times the benefit, 30 times. Okay, so that's a fairly straightforward calculation that says this is not going to be worth it when you are measuring lives versus lives. One thing that we didn't do on our paper, though, was look at the impact on education. And I think this is also quite interesting. This is a South African data too. So your relative mortality, assuming that you have a four-year degree or higher tertiary qualification, is then 1. And if you haven't completed high school in a South African context, your mortality is about double that. Now, bear in mind, this is on top of an income change I showed you before. So you could say that you could say, generally speaking, someone with a four-year degree earning 40,000 Rand a month, comparing to someone earning almost no money and having not completed high school, you actually got to take 3 times 2. So it's a 6-fold increase in mortality. So when wealthier, educated people are dying at a rate of 1 per 1,000 a year, the poorer, less educated people are at about 6 per 1,000. Okay, so it's a very significant difference. Now, the reason why we didn't cover this in our paper last year, because we didn't anticipate how badly disrupted education was going to be globally and specifically in South Africa. Then last week, a study came out, and I'm just going to put one excerpt of it on the screen now. So South Africa runs a quarterly study called NIDS-CRAM, and it's basically looking at levels of poverty and unemployment and things like that. And they do it quarterly so they can actually measure how things are changing. And this came out a week or two ago that said that in South Africa, an additional 500,000 children have dropped out of school during the pandemic. 500,000. I want to actually just I want that number to land. 500,000 kids additional in a country with a population approaching 60 million. And these are kids that have left the education system. So when our schools closed and opened and closed and opened. So in the periods when the schools were opened again, these kids were gone. They weren't in the system anymore. The authors go on to say it's possible that some of them will come back into the system once things normalize, if and when that happens. But it's very profound but they also acknowledge that the longer kids stay out of school, the less likely they are ever to come back. Now, just think about the impact that this is going to have on those children and their futures in terms of their life expectancy, like I've just explained. And what really bugs me, and I think Zenobia covered it really, really nicely in the panel earlier, is that these children are paying the price for a response to a pandemic when we know the impact of that pandemic and the risk that they themselves were bearing was approaching zero. We know that. We knew that at the beginning of lockdowns last year. I also have some of the UK data, but Professor Miles's paper was also discussed this morning, so I'm going to very quickly spend time on this slide. But their study was also showing how the other costs that we talked about earlier, about cancer investigations being down, outpatients not being seen as often, elective admissions being down. This is true globally. This also happened in the South African context. So I've got and then this was covered this morning about even in the most generous interpretation of lives saved versus cost of lockdown, it was still a net loss to have done it. Now, moving forward, I've got 5 minutes left. So some things that we could think about doing better next time. The first 3 I've got up on the screen is that what I've touched on earlier now is that when we are making these big, when governments are making these big public policy decisions, we need to be quantifying all the costs. We need to be attempting to quantify them, especially second order effects, because often it's easy to just look at the immediate impacts of something, but you need to be thinking through the second order effects of both long and short term. The second one I think is really important and it's been mentioned again throughout the day, we need to be having a wider focus on these things. Other outcomes matter alongside transmission rates, hospitalization rates, and mortality rates from a single cause. To put that in perspective from a South African point of view, we are in the midst of a third wave, and in the first, second, and third wave, we had a handful of days where the number of COVID deaths reported on a single day was about 500. Now, to put that into context, in South Africa, on any given day, we have 500 deaths from communicable diseases in this country. Of those 500, about 80 of them are happening in under 5-year-olds. That is the reality. That is a normal day in South Africa. Communicable diseases that are actually almost non-existent in the developed world. So when we focus on a single disease like COVID, what do you think is happening to the other diseases that we are dealing with anyway? The third point is, and has again been said today, is more voices should be in the room when we are debating these things. Speech should not be suppressed. These debates should be in the open. I was thinking earlier, the panel just immediately before I spoke and the one before your lunch, imagine if those voices were in the SAGE room debating what should be done on policy, how different the response may have been, instead of having single voices from fields of epidemiology and virology with a narrow focus instead of the wider focus. I think this is going to, and again, as the introduction said to this, is that this approach is not about COVID. This is about how do we talk about climate change and other globally topical challenges that are facing us. The last three also seem to be should be fairly straightforward to understand. The fourth one was transparency. So policymakers should actually be transparent about what data is informing their decision. How are they measuring those? How are they measuring success? How are they quantifying success? And how are they measuring the costs that we would hopefully they would have told us beforehand? Fifthly, honesty, tied to transparency clearly, is that willful misinformation from governments and media is ultimately going to erode trust in public health and worsen any response. I saw a paper about 2 weeks back that the CDC published that did a deep analysis of all their hospital admissions of their COVID patients over the course of the pandemic, and there were slightly more than 500,000 Americans that were admitted during the pandemic. And what struck me was one thing that we kind of knew already, that about 95% of those people had pre-existing conditions. What I found really interesting was the top 2 pre-existing conditions that were in that data set. The first one, as shouldn't be surprising, was obesity. The second one was really surprising to me, was anxiety and fear-related disorders. Now think about that for a second, is that those two pre-existing conditions, obesity and anxiety, were highly predictive of bad outcomes from COVID. And what our governments did is they locked us down in our homes. Many places closed gyms and abilities to get exercise. In South Africa, we went through a period where we were simply not allowed to even go for a walk outside. And we fed everyone a diet of fear. So we actually probably made our susceptible populations worse through the course of the last 18 months. And the final one, and I'm going to wrap up here, is about decentralization, which Nick has mentioned a couple of times today too. And it's tied to what I said a bit earlier, is that every country and every region has its own unique circumstances and essentially cost-benefit profiles. It's the same debate around vaccines, is that we know that certain people, like children, for example, carry essentially no risk to this virus. So a singular approach, like a lockdown or a vaccine approach, makes very little sense. And we shouldn't have the WHO dictating from a central body telling every country, including a poorer country like South Africa, who incidentally, I think someone mentioned furloughs earlier. Our version of a furlough was that people got given 350 Rand a month if they were below a certain income level, which equates to just under £20 a month. We can't afford the kind of things that other countries can, and a single response to the pandemic like we saw is highly inappropriate. So that is it, and I'm on time. So thank you very much for having me. I hope that was interesting.